Today, our guest is Javier Hernandez. Javier is an immigrant and queer leader fighting for immigrant rights in the Inland Empire. Javier believes that justice for immigrant communities includes addressing all the intersections that are critical to the undocumented identities such as health, poverty, criminalization, and other disparities that keep the undocumented marginalized. Today, we'd like to welcome Javier Hernandez, Director of the Inland Coalition for Immigrant Justice. Welcome, Javier.
Hello, everyone. Thank you for having me.
Javier, what unique challenges do you believe undocumented immigrants face during the pandemic?
So, when the pandemic first hit, a few months ago, the first thing that we actually did, as a coalition, we talked to our partners, right? We're a coalition of 50 plus organizations that we work with that are, that are working to advance immigrant justice here in the Inland Empire. And so we talked to our partners, and then we went to our community to really just have a conversation with them and see, what they were thinking, right? This is at the very beginning of the pandemic. What they were concerned about, and the first thing that we heard was just really the concern about healthcare during during this pandemic. A lot of folks were concerned that if they were to become sick, if one of their loved ones was to get sick with COVID, that they would not be able to get healthcare services. That was one of the first concern that we saw, that we heard from the undocumented community directly, that we went to speak with, and so it's important to highlight that, the Inland Empire, we have two counties, San Bernardino and Riverside. And San Bernardino County is one of 11 counties in the state that doesn't provide a safety net program in regards to healthcare for undocumented individuals. And that means that undocumented folks can go to, to a hospital, but they would receive services just for that day. There's not necessarily a follow-up service, similar to like My Health LA in Los Angeles County, right? Which is just, borders San Bernardino, and even Riverside County has an MISP program for undocumented individuals. So that was the first concern that we heard from folks. The second concern from that was, well, if I do become sick and I do get healthcare services, would this count as public charge? Public charge was a federal policy through this administration that said that if a person that didn't have status, or a person with status, but not a U.S. citizen, used public services such as healthcare, or many different services that are provided for folks that are in need, that they would not qualify to adjust their status. They would not qualify to adjust their status from undocumented to green card, or from a green card to a U.S. citizen. So many folks were concerned about that as well. Fast forward to a month into COVID, what folks started really getting concerned about was just their financial, just financial stability. Many folks had lost their jobs, their hours had been cut, and they were just worried about being able to pay rent. And that was a month in, right? Being able to pay rent, being able to pay, the basic bills, right? And so, your electricity, your water bill. And then fast forward another month from there, and what we started hearing was just people started getting concerned to even have, the funds to buy food, right? And so we saw the different situations, right, and the different challenges that the immigrant community was facing came in stages, right? The first one was obviously fear, like anyone else, right? What would happen if I would get sick? What would happen if my family gets sick? Do we have healthcare? Does that healthcare, would that healthcare affect the future? And then, little by little, it was financial. Now it's, survival, right? Can we even buy food for the next week or the next month? And so this is, these challenges are not necessarily, I would say, unique to the undocumented population, but I would say, well, some of them are, right? But I would say that the way that undocumented people the services that are offered, that's where it becomes a unique experience, because of the fear that this might affect them in the future.
What additional fears and anxieties do undocumented immigrants face amid the COVID crisis?
So I think the first one that I mentioned was the public charge rule, right? That was a big. We did as a coalition and also a statewide and even nationwide, there was organizations that really went out and put the message. If you get tested for COVID, if you get sick and you get services, this will not charge for public charge, right? This would not affect your public charge eligibility. And so we saw that even from the White House, right? That message coming out because we were facing we still are facing such, an unprecedented pandemic, I guess in our times. And so even, the message from this administration was go get tested, go get, medical care if you need it. And that really helped ease some of the anxiety. I would say not all of it. It's important to note that folks don't necessarily trust this administration. Folks don't necessarily trust their local government. Sometimes undocumented people don't even trust their local police departments. And so there's a lot of mistrust between undocumented communities and, the power structures in our society. And that is because of just history of how, federal government agencies such as ICE and Border Patrol have been working and colluding with with local law enforcement agencies and even hospitals. We've seen people getting deported from hospitals back to their home countries. So there was a lot of mistrust, right? And I think that's, there was that anxiety, regardless of the messages that were going out of get services, get the support that you need. There was mistrust in these folks that were supposed to bring you support. One of the anxieties and one of the concerns that we heard from the beginning, and even the state government was concerned of how this might play out, was when the National Guard was deployed, and it was deployed to support with food distribution if it was needed. And we heard from many folks, we asked, well, what would that mean to you, right? If you were asked to go to a food bank and you see the National Guard there, a lot of them said that they wouldn't go. A lot of them said that they would not feel comfortable. We brought those concerns back to the state government and said, if this is, a solution to the problem, it might not be the best solution, right? To have the National Guard there for food distribution. And so we had, we were able to bring these concerns back to the state agencies, right? I think another anxieties for undocumented immigrants, it's also just if someone in their family does, get sick and they lose income, I think it goes back to the financial stability. What does it mean, not just for the short term, but for the long term of their family? And also we did, there was some folks that even shared that they were, had a plan to self-deport if it came to a point where they could no longer survive here in the US, meaning financially, right? Like if there was no jobs, if there was no stability, then they would just uproot their families. Some of these folks have been, some of the families that we spoke to had been here for 20 plus years, and they were willing to just uproot and go back to, a lot of them back to their home countries, because there was a lack of resources that they felt they weren't getting the support that was adequate for their specific needs.
This is really informative. What is being done to assist those individuals in overcoming their fears and anxieties?
So the first thing that we did, as I mentioned, was we did a campaign where we were informing undocumented communities, about what resources existed. One of the when we were thinking through how do we bring resources to community, right? How do we make it accessible to communities? And one of the fun things that we did was that we we've been using this texting system, and so what we decided was, well, let's just do a text message where people would text the word recursos, so the word resources, to 797979, and what they would find was a very comprehensive resource list for the Inland Empire residents, specifically for undocumented communities, right? So it included legal service organizations, right? If there's an issue with if ICE comes to your door, if you need legal assistance for whatever of any kind, we had legal resources there. We also had food banks, right? And these food banks were food banks that we had reached out to and asked, what are your, do folks need to present an ID? Do folks need to present proof of income? Do they need to present a proof of address? What are the documents needed to be able to access, food? And so most of these places had a requirement of an ID, right? And when we spoke to them, we said, we just, we shared the concerns of our community, and said, is there a way that we can just say, come and get food and, folks don't have to show an ID? And many of these food banks were very open to that. They said yes, that, they didn't see a problem with that. They understood that we were in the middle of a pandemic that was going to cause a lot of need. And so they were open to just being able to provide, food without having to provide an ID. And so part of that resource list, we had resources all the way from southern Riverside County up to the high desert, from Pomona all the way to the Coachella Valley, right? And so it was food banks, legal service providers. We also had information on the healthcare services, information on the public charge, right? That none of this would affect folks' public charge status. And so that was the first and easiest way for us to really just put the information out and made it accessible to community. We knew that we weren't going to be able to do know your rights forums. We knew that we weren't going to be able to go to a church, which is usually what we do, right? If we want to get a crowd of over 500-600 people, we go to the congregations and talk to people directly, but we knew that wasn't going to be possible. So the next best thing was, let's deliver the information to people's phones so that they can easily access it there. I think additionally what we did was really we started doing advocacy as well, right? So it wasn't just let's inform community, but also let's advocacy to those folks that are stakeholders, that are decision makers, that they can see this this pandemic and see the implications that this will have in our communities for many, many years. And so one of what we're asking right now on the state side is for for healthcare for our elders, undocumented elders 55 and over, or 50 and over. We're asking the state to provide, the medical services, throughout the state, right? Because we feel, that someone's healthcare should not be dependent on the county that they live in, right? Because we know, again, San Bernardino County does not have a program, and yet Riverside and LA County do. So, there's so many inequities in that, and the state, we believe, could and can step in to actually provide those services that are necessary in our communities. So the first part was giving people resources. The second part to us was our advocacy work, which is what we do. We're an advocacy coalition, and we wanted to ensure that we were advocating for these communities.
Love that.
Yeah, thank you.
How has healthcare for this population been affected? I think you shared this numerous times in your responses previously, but can you just kind of hone in on how the healthcare has been impacted?
Yeah. So, so healthcare. I think when we talk about the undocumented population, we're talking about a population that's already where healthcare is lacking, right? Where we look at where undocumented folks cannot even access healthcare, even if they had the funds to do it. So, right, even through Covered California, right? Even if you were an undocumented person that had the resources to buy your own health insurance through the exchange, that would not be possible. Right, and so we're talking about a community that has been left out, of healthcare services for many, many years, right? And this has happened intentionally, right? It's whether it's intentionally based on politics, right? We're not saying we know that ideally most of our decision makers would want, everyone to have healthcare, but unfortunately politics is a different story. And so when healthcare has been so politicized in this state, in this country, even in our county, where access to healthcare is dependent on your immigration status and is dependent on whether you have a job, and so. Because of this, we're already talking about a population that has been historically just left out of healthcare in general. And then when we talk about how this population has responded with COVID, I would say, like with this pandemic for their healthcare issues. I think one story that comes to mind is it's a family that the daughter became, she tested positive for COVID. She was able to go get a free test. However, she passed that, she couldn't get healthcare services, right? She couldn't, she didn't find a way to be able to walk into a clinic and get some healthcare services for the follow-up, right? The COVID test was free, but after that she couldn't get services here in San Bernardino County. And a lot of it was, she didn't have the proper resources. We were able to connect her with some resources. But again, if you're getting a test and all you're getting is a positive result and you're not being told what to do next, this is a huge problem, right? And so what happened after that, the family then stops working. All of them decide, okay, they're no longer going to go to work. The mom made the decision to stop working until they got tested. They went to get tested. They all of them actually came back negative. So they decided to go back to work. But then again, their biggest concern was if something happens to our daughter, right, or our sister, their concern was that if they didn't work and they needed resources, to maybe take her to the hospital, to take her to doctors, that they wouldn't have those resources. I think ideally, they would have liked to stay home a little bit longer to continue testing until they found, done like the 14-day quarantine, but they didn't have that opportunity. So when we talk about healthcare for this population, I think we should also talk about the fact that not having access to healthcare is also a threat to public health, because folks have to go to work, folks have to go to school, folks have to live a normal life as much as possible. And what we found was for many low-income communities, they were essential workers because they were working in construction, they were working at stores that were still open, and folks folks had to go to work. And so seeing this healthcare issue as a public health issue, I think it's important. And I think it's a way that we can actually move our local or even our state decision makers into action, so that if we can cover all of our community, if we can give healthcare to everyone in our community, then we know that there's ways to protect all, our community and our state, especially like in a pandemic such as this, where if we would have had healthcare for every Californian, I think we would have been able to been open much sooner. We would have been able to have folks testing, we would have been able to get folks in care, and a lot of folks simply did not go to the hospital. They simply did not go to to a clinic because they didn't have access. When we talk about undocumented families, we have to remember that there's mixed status families as well, where some family members can have services and others can't. And then we also have there's that creates a whole other dynamic on the public health and also on the health of undocumented mixed status families.
Well, many Americans are receiving unemployment and stimulus checks. What is being done for undocumented immigrants to provide them with access to the same financial assistance?
We know, again, I think this is where we're in an unfortunate time in our system, right? Where the stimulus checks very intentionally left out not just undocumented folks, but also undocumented families or mixed status families. So what would with the stimulus check, we have a family that's undocumented, and both parents file taxes with their I-10 number, and they have U.S. citizen children. Let's say they have 2 or 3 U.S. citizen children, and they include them in their taxes. When Congress passed the stimulus package, they intentionally left out anyone that filed with an I-10 number. Right? So now you have a family that might be mixed status, where the parents are undocumented and the children are not, but they're not receiving any stimulus. You also have mixed status families where one parent is a U.S. citizen and the other one isn't, and they filed taxes, but because the adults, the breadwinners, one is undocumented or they filed with an I-10 number, they were also excluded from receiving the stimulus check. So we're talking about millions of families across the United States that were left out of the stimulus package simply because either they were undocumented and filed with an ITIN number, or one of the spouses was undocumented and filed with an ITIN number. So what we have there is obviously just inequity, right, in terms of financial distribution, right, of here of the stimulus checks. What California did, and California was the first, I believe, in the nation to do this, was the state of California pulled in and put into a community fund $75 million. Private philanthropy was going to come in with another $50 million for a total of $125 million. And what was decided was that community organizations were going to provide this support to families here in California, for undocumented families specifically, or mixed status households. And the requirements were that that you lived in California and that you were able to provide that you were a resident of the state. You had to provide that you had to prove that you were undocumented, which left a lot of people scared because they were like, well, you're telling me to go tell you and show you that I'm undocumented.
Absolutely.
But then what happens with that information, right? And so folks were really scared of, what would happen once an agency has my information and proof that I am undocumented, who has access to that? But nevertheless, what we saw when this program rolled out just a couple weeks ago was an overwhelming need. There was one organization based in LA that in the first day alone, they received 1 million calls, but were only able to process about 200 of those calls to be able to, for folks to be able to receive these checks. The checks that were being, provided were 500 for individual or 1,000 per household. So in the Inland Empire, we have two organizations. One of the organizations in the first day received about 15,000 calls, and they were only able to vet about 50 to 75 of those calls, right? And so when, we are really thankful that the state of California took a step that no other state has taken before. However, we understand and we know that this is not enough. When we have a community, the undocumented community, that is really the backbone of the infrastructure of this state, and that is the backbone of the economy of the state. When we have, a large majority of our farm workers that are undocumented, a big majority of our logistic workers, folks working in warehouses, are undocumented, and all these are essential workers, and we're telling them that you're going to get 500 to 1,000 if you lost your, if hours were cut, if you lost your job, if you got sick, that you only get 500 to 1,000 one-time check, that you don't get state unemployment, that you don't get a state disability insurance, that you don't get a federal stimulus check. It becomes really, it's a concern, right? Because a one-time payment of $500 to $1,000 for these families that have not worked for 3 or 4 months, obviously it goes a long way, but it does not meet the need again of this community. And I think what we did on our end was, again, we're an advocacy organization. So we went to our state legislators and said, this is great. However, we can do more for this community. And we're asking state legislators for a safety net program for all that would include a program similar to unemployment, but specifically for undocumented communities. And then also like a stimulus check for our undocumented community. For the next couple months as well. And so we're asking for structural change, not necessarily charity right now, right? We understand that these dollars will go a long way, but in order for us to be ready for the next pandemic or for the next emergency that we might have in our state, we need to have structural change. And we believe that this is the time to take on these challenges. As Californians, we have never backed down from challenging times, and we believe that this is just one of those times where we have to step up again and really come through and support our immigrant communities.
Wow, this is amazing. What barriers does this population face in accessing resources or obtaining help? You also mentioned the fear when there are services available to them or resources available, they have to disclose their status, and the fear that invokes in them. What, I know that's one of the barriers. So how can we help them be able to access services and not, be in fear of being deported or some harm coming to their family as a result of them just getting the resources that are available to everyone else?
Yeah, so I mean this is I think a great question, and we've had many folks asking this question, and the first thing we talk about is what does access mean to someone, right? So for someone that's undocumented, many times when people say, well, we need an ID, we have to remember that it wasn't until 2016 that undocumented people were able to get a driver's license here in California, right? Prior to that, folks had a matrícula consular from their country, or they had a passport from their country, and that was their only form of identification. And prior to 2016, having these two forms of identification was in a way criminalized, because this is the only ID that you can show to a police officer when you get pulled over, and then you need to show an ID. And so what that created was just the fear, right, of like having to show these documents again. What would that mean to prove that you're undocumented, like for the state help? What would that mean, for their families in the future? What the state did, to actually to remove some of these barriers, specifically for that fund that they created, was that the state is not keeping any of this information. The nonprofit organizations that are doing the vetting are the ones that are keeping this information. And there is a third party that is issuing the debit cards. So the state just issued the funds and the nonprofit organizations were the ones doing the vetting, which removed the barrier of the state being the one that's keeping this information, right? And that was a good step. ICAJ as a coalition, we also we did a community fund as well. Up to today, I think we are going to be giving out close to $185,000 in checks to community members. We did not ask specifically or directly about people's immigration status. We did not ask them to present any documentation. We did not ask them, to show us any proof of state residency, right? We know that the folks that are applying are the folks that need the support. And so what we did was we created a system that where folks applied, they gave us an address that was here in the county, and then we're issuing checks and to those communities. So when we talk about the barriers, if we're asking people to show IDs, if we're asking people to proof of of their address, that is where folks start getting scared. And it's important to note that their fear comes from many years of being criminalized, right? We start with not being able to have a license, then we talk about programs like 287G and secure communities, which where ICE and local law enforcement could work together. So it's fear it's not a fear that's new. It's a fear that has been in our communities for many years. And so yeah, that's definitely one of the biggest barriers, having to present an ID. The other ones that we have heard are language barriers, right? So being able to speak the same language as as the folks at a food bank, being able to speak the same language when you're doing the test, the testing for COVID. Some folks are not asking for translation. Again, they just don't want to they don't want to cost too much attention to themselves, right? So they're just getting the testing, not getting the information in their language, or not getting the proper information, I would say, because they're not asking too many questions, because again, there's a fear of, if I ask anything, if I make it seem like that I don't understand the language, then this could have some repercussions in the future. One of the other barriers was even, and this is not I don't think this is a barrier specifically for undocumented communities, but transportation, right? How do you get to and from a food bank if you need to go pick up some food? Those were just like a few of the barriers that I can name off the top of my head right now.
Those are awesome. So what resources are available for undocumented individuals that you have knowledge of, providing assistance to crisis-related issues?
for folks that need assistance here in the Inland Empire, we let them know, specifically immigrants and undocumented immigrants, is to check out our list, which is, again, it's recursos to 797979. There's also an English list, same list we just translated it. So resources to 797979. So the first thing that I would say is food banks. The food banks have been very understanding of the situations that we're in. There is extraordinary need in our communities, and the food banks have really stepped up to this challenge and have removed a lot of those barriers so that folks can actually access the food that is needed, for their survival. So I think you can find the list there. The other resources I would say, there are community clinics here in San Bernardino and in Riverside that provide resources to undocumented communities and provide services to undocumented communities. And although it's unfortunate that, that during this time, this is what, brought us closer together to these clinics, it's important to note that these clinics have existed for years, but, because of the political climate that we're in, they're not out there, saying we take undocumented, folks, we can serve undocumented communities. And that is just because, they want to continue to provide the services and ensure that there's no backlash for these services that they provide. But there are clinics that are providing services to undocumented communities. When it comes to financial assistance, we have a fund. We open it, it's not open all the time, because it's a lot of funds. As I mentioned, it's $185,000 that we're already going to be giving to our communities. But there are the other funds through the state of California. So folks can find those through the CDSS website, the California Department of Social Services website. And it's the financial assistance and the organizations that were chosen to support with this program are chosen by region. So there is a Inland Empire region, which are 2 organizations. And so I highly recommend folks to check those 2 organizations. One is San Bernardino Community Services Center, and the other one is TOREC in Paris. And San Bernardino Community Services Center is in San Bernardino. And these 2 organizations are providing those financial support and financial assistance that's coming from the state of California to our community. And there are many other organizations that have smaller funds and pots of funding, like the Pomona Day Labor Center. They have a fund that's also for financial relief. However, it's very specific to day laborers. As we know, day laborers, number one, I think they're very vulnerable and some of the most vulnerable in our communities. They're looking for jobs in corners. They're huddled. They have, they're together, and they're huddled in the corners, not just because they have, a sense of family and friendship, but it's also for protection because for many years, these day labor corners have been attacked, from not just from anti-immigrant groups, but also Border Patrol, have raided these day labor corners in the past. And so when we talk about a community like day laborers that are now unfortunately not working, the Pomona Day Labor Center was able to step in and provide some of those resources to them as well. So there are many, many resources in our community. I think the best way for folks to access that is by checking out the list that we made. Again, that's resources to 797979 or recursos to 797979.
Thank you, Javier, for educating us on the inequities the undocumented community is facing during this pandemic. We really appreciate your advocacy and being a voice for the voiceless. I look forward to our continued partnership and working closely at the Center for Healthy Communities and making sure that all of us have access to health care.
No, thank you all so much. Many times when we talk about marginalized communities, it's easy to not think about undocumented folks, just because it's such a complex issue and topic. But we thank you all for taking the time to listen to us, and also just want to encourage folks to continue learning more about what undocumented communities face. And we've done many partnerships with UCR, and we look forward to continuing that partnership with you all.